Computerized tomography, very widely referred to as CT scan, is very familiar with most of us. It is a modality which is used for diagnosing disease conditions any part of the body, from head to toe. It is extremely useful for evaluating a disease of the chest, which is the next best modality that is used after a chest X-ray. And it gives beautiful pictures of the interior of the body, be it chest or abdomen. There are two types of scan, both non-contrast, otherwise called the plain scan, and the contrast scans. What you mean by contrast scan is that it is done after injecting a contrast agent or a dye into the body, which is injected through one of the veins in the hands or in the extremities. So it is just a simple injection to the hand and then the scan is taken. So of course the prerequisite for this is that the patient should have a normal renal function. So it is required to check the renal function or the serum creatinine at least prior to going ahead with the CT scan, prior to giving the contrast injection. Of course, it is the CT scan is an imaging modality which uses radiation, which involves radiation because it is done using X-rays. However, its benefits far outweigh the risks that is involved with the radiation. It's something that has to be kept in mind is that it should be used with caution and especially in the pediatric population, and it is not usually done in the pregnant women where you prefer ultrasound or MRI and you try to avoid the radiation to the unborn fetus. Otherwise, it is one of the most beautiful and most widely used and most beneficial and investigation modalities that is included in the imaging armamentarium.